Bursitis is a condition characterized by inflammation of the bursae, small sacs filled with fluid that cushion and lubricate areas where tendons, ligaments, muscles, or bones rub against each other. It can occur in various parts of the body, but it most commonly affects the following areas. Shoulder bursitis, also known as subacromial bursitis, is a common type of bursitis that occurs when the bursa between the rotator cuff and the acromion, a bone on the top of the shoulder, becomes inflamed. This can result from overuse, injury, or underlying conditions such as arthritis. Elbow bursitis, often referred to as olecranon bursitis, occurs when the bursa at the tip of the elbow becomes inflamed. This can be caused by repetitive pressure on the elbow, such as leaning on hard surfaces or by direct trauma. Hip bursitis, also known as trochanteric bursitis, occurs when the bursa located near the greater trochanter of the femur, the large bony prominence on the side of the hip, becomes inflamed. This can result from overuse, injury, or underlying conditions such as osteoarthritis. Knee bursitis can occur in several locations around the knee joint. One common type is prepatellar bursitis, which affects the bursa in front of the kneecap, patella, and can result from frequent kneeling or direct trauma to the knee. Heel bursitis, also known as retrocalcaneal bursitis, occurs when the bursa located between the Achilles tendon and the heel bone, calcaneus, becomes inflamed. This can be caused by overuse, tight footwear, or underlying conditions such as Haglund's deformity. While these are some of the most common areas for bursitis to occur, it can technically affect any area of the body where bursae are present, including the ankle, wrist, and foot. Symptoms of bursitis typically include pain, swelling, and limited range of motion in the affected joint. If you suspect you have bursitis, it's important to consult with a healthcare professional for proper diagnosis and treatment. Here are some natural remedies and lifestyle changes that may help alleviate symptoms of bursitis. Rest. Avoid activities that aggravate the affected area to allow it time to heal. Resting the affected joint or area can help reduce inflammation and pain. Ice therapy. Applying ice packs to the affected area for 15 to 20 minutes several times a day can help reduce inflammation and relieve pain. Be sure to wrap the ice pack in a cloth to prevent direct contact with the skin. Compression. Using a compression bandage or wrap can help reduce swelling and provide support to the affected joint or area. Elevation. Elevating the affected area above the level of the heart can help reduce swelling and improve circulation, especially when resting or sleeping. Glucosamine, present in cartilage and muscles, is believed to aid in bursitis inflammation relief. However, caution is advised for those on blood-thinning medications due to increased bleeding risk. Gentle exercise. Once the acute pain and inflammation have subsided, gentle exercises and stretching can help improve flexibility, strength, and range of motion. However, it's crucial to avoid activities that exacerbate pain or put strain on the affected area. Physical therapy. Working with a physical therapist can help develop an exercise program tailored to your needs, focusing on strengthening and stretching exercises to improve joint function and reduce pain. Topical remedies. Applying topical creams or gels containing ingredients like arnica, menthol, or capsaicin may provide temporary relief from pain and inflammation. Heat therapy. Some people find relief from alternating heat and cold therapy. After the initial inflammation has subsided, applying heat to the affected area can help relax muscles and improve blood flow. Maintain a healthy weight. Excess weight can increase stress on joints, exacerbating symptoms of bursitis. Maintaining a healthy weight through diet and regular exercise can help reduce strain on the affected joints. Anti-inflammatory diet. Your diet can affect bursitis, a type of body inflammation. To help, it's important to avoid foods that cause inflammation. Meat is very good at fighting inflammation, and fish has omega-3 fatty acids that also help fight inflammation. These fatty acids work in different ways to reduce inflammation and lower the amount of inflammatory substances in your body. By cutting down on certain plant foods, especially those high in substances like oxalates, phytates, and lectins, your diet can reduce common triggers for inflammation. Some foods with high oxalate content include spinach, Swiss chard, amaranth, taro, sweet potatoes, beets, rhubarb, and sorrel. Raw legumes, whole grains, nuts, cocoa, and tea also have oxalates, but in smaller amounts. It's essential to consult with a healthcare professional for proper diagnosis and treatment, especially if symptoms persist or worsen despite home remedies. In some cases, more intensive treatments such as corticosteroid injections or physical therapy may be recommended. Thank you for watching. Please like, share, comment, and subscribe to Remedy Seeker for more health tips, and we'll see you in the next video.